I will call the Winnebago County Community Mental Health Board meeting, May 1st, 2024, 4:00 p.m. order. Roll call. Mariana Body, present. Dr. Copeland.
Present.
Dr. Giardini.
Present.
Dr. Gorski.
Present.
Dick Cooner.
Present.
Wendy Larson-Bennett.
Present.
Tim Neighbors. Linda Sandquist.
Present.
Mohammed Yunus.
Yeah.
Jason, welcome. Chelsea, Mark, and Nicole. So we're happy, and all of our guests are happy you're here today. We will have a public comment, and that will be Linda Sandquist.
This is from a letter addressed to Mariana Body as president of the Winnebago County Community Health Board. Dear Marianne, please accept this letter as my resignation from the Winnebago County Community Health Board. On May 6, 2024, I will join the staff of Rosecrans, and this disqualifies me from sitting on the board as Rosecrans received grant funding. Serving on the Mental Health Board has been one of the finest experiences I have had. Although I worked in the grant-making sector for over 15 years, I have never seen such a dedicated group of people as the Mental Health Board. Your extraordinary leadership during COVID, when the board diligently met by Zoom, and afterward, as we met in person, created a board of grant makers who continually think thoughtfully and deliberately to decide how much funding much-needed mental health services should receive. The leadership of Jason Holcomb and his team created a Class A grant-making system that exceeds any other system I have ever used. Their role as our administrators demonstrates the very best way government can faithfully and ethically ensure that taxpayers' money funds services that are desperately needed. While I can no longer sit on the board, I will be cheering you on from the sidelines. I am very proud of having served on the board with you and my other colleagues who truly have the best intentions of making sure Winnebago County is a fine place to live.
Thank you, Linda. I just want to thank you for your contributions. You're going to be missed. You really helped us as, initial board member to get this kind of harmonized, and your opinions and your experience brought so much to our decision making. So thank you so much.
Yeah, I just have to say, you altered my view of how not-for-profits do and should be funded in our community. So the constraints they struggle with and the reality of how it should be. So thank you for broadening us.
If I may add, I want to thank God that you're not moving. Seriously, when you first made the sentence, I'm like, but I'm glad you're still in the ecosystem, because you are one of those individuals that make living in Rockford worthwhile, because you helped to change things. You've done that in several different capacities, and we look forward to continuing to work with you now in this new perch.
Thank you. Thank you. Okay, we have two presentations today. The first one for Accelerator Award presentation is the Regional Office of Education. I'll have you introduce yourself as you speak to the board and the group.
Good afternoon. Thank you for the opportunity to share with you for a few minutes our heart and our passion behind why we wrote for this Accelerator Award. My name is Scott Lundquist. I'm the Regional Superintendent of Schools for Boone and Winnebago County. I'm in my 5th year as Regional Superintendent. Prior to coming to the Regional Office of Education, I was the District Superintendent for the Winnebago School District. You have my presentation, I believe, in front of you, and it was shared with you ahead of time. And I'm probably not even going to go through every single one of these slides, slide by slide, word for word, because I really just want to speak to you from my heart, from what I've seen as a nearly lifetime educator working with kids and working with kids in our community, and especially with working some of the most at-risk students in our community. Oftentimes we look at You know, what is a crisis? And even in writing this grant, one of the things that was difficult for me at times was how am I going to help convey to you, the board, how physical safety and school safety is directly tied to mental health. And what I will share with you as being an educator for over 20 years now is that if we don't have schools that are physically safe, students are not going to feel emotionally safe. And if we don't have schools where students feel emotionally safe, we're not going to have schools where students feel physically safe. They go hand in hand and they are tied hand in hand together. So as we look at what a crisis happens, and a crisis happens in any one of our schools every day, and what is a crisis? A crisis could be a major situation that takes place, like one that took place a little bit ago today in Mount Ward, Wisconsin, in a middle school that had an active shooter approach that school and was thankfully neutralized because that student was not able to breach the school and create any other damage or killings in that school today because they had a safety plan in place and that kid could not get into that school. But I'm telling you, there's going to be trauma in the aftermath of that physical crisis that took place today. There's going to be trauma of every student and every staff member and every parent in that community that is now questioning whether they feel physically safe and emotionally safe in the aftermath of that event that just took place today. So when we're talking about crisis, it is anything that can have an adverse effect on the emotional stability and the mental health of our students. And many of them are things that can be proactively taken care of ahead of time if we have the right resources in place in our schools. So as I shared earlier, these two things go hand in hand, emotional safety and physical safety. Without both of them being married together in our schools, we are not creating the safest environment and the best environment for our kids to ultimately succeed. The funding that we are seeking is going to really help us be able to collaboratively bring together our non-public and our public schools across Winnebago County, I believe Boone County out of it. To be able to provide a lot of support to them, that they are not all readily prepared, they don't have the resources at the time, the expertise to actually focus on many of these things. Why are we strategically positioned for this? I will say as the Regional Office of Education, we are the only entity within our county that is strategically placed to provide direct support and impact to every public and non-public school within our county. Why? We have been in existence for over 100 years. We are the trusted name. We are the one that when we knock on the door, our public schools and our non-public schools will answer the door because they know who we are, they know what we stand for, and they know that we are here to advocate, educate, and serve them. And we have been in that position and working continually harder to be able to do that. And I believe that we are the only organization that has that direct tie, that direct charge, the direct even authority from the State Board of Education to partner and collaborate with all of our public schools and yes, even our non-public schools within our county. When we look at what do we want to do and how these are tied together, just to give an idea of what we are talking about student-wise and the impact that the Regional Office of Education has. To some degree, with the work that we do, we have direct and indirect ability to influence over 45,000 of our students within our county. That is a lot of people that we have that direct touch to, whether it's through the programming that we offer and the services that we're wanting to expand through this grant. I'm going to take a little bit of time on this one, and you have more detailed information already in your packet, because when we look at safe and secure schools, it is really a threefold approach to how we're going to do it. It is what are we doing before a crisis, during a crisis, and after a crisis. Where mental health comes into play with all of this is everything that is done before a crisis. It is the structures and the systems and the training that is in place with our teachers, who we will say, myself and my assistant superintendent, we've trained for the last 7 years on threat assessments. That has been a best practice by the U.S. Secret Service and the Department of Education. We've traveled all over the state training thousands of administrators and dozens of schools on this. And a huge component of school safety comes down to warning signs and concerning behaviors. What are those things that have been identified going on in the life of a kid that if schools have a well-thought plan in place to address those issues before they happen, the vast majority of a crisis is actually averted because we handle it before a crisis happens. So some of those things in place that we are going to use this money to provide free or reduced, for the most part, hopefully free training to every public and non-public school that wants to partner with us is in the area of comprehensive threat assessments. Our non-public schools do not have those in place. We have a lot of students in our non-public schools and they are not prepared to how to handle any crisis that takes place. And how can I speak from that in authority? Because one of our jobs at the regional office is to every 5 years go in and do a comprehensive audit of these schools and we see what's going on. There is a There is a deep need to be able to provide support to our non-public schools as well. Trauma-informed care goes beyond a single training. How do you actually implement trauma-informed practices? How do we recognize what is going on in the life of the students? How do we recognize when a kid walks in the front door, if it is a cloudy day or it is a sunny day? And what supports and interventions can they have in place, real-time triage to help those kids the moment they walk in the front door? And we have training that we are ready to go that we can implement immediately to help that. Down to social emotional support, multi-tiered systems of support, restorative practices are all things that are training that our adults need on a regular basis so that we can meet our kids where they're at and provide the right type of social emotional mental health support on the front end of who they are before any type of individual or corporate crisis might happen in our schools. Another piece that is in this grant we're looking at before the crisis are those facility audits. We have a staff member that we hired in advance of hopefully getting this grant that has been trained and is going to get more training on what is called crime prevention through environmental design. And that is a training and a certification that is generally for architects that I feel passionately about. We need a school-based person. Why? Because when we knock on the door and say, can we do a comprehensive safety assessment of your school, they're going to say yes to us more likely than an outside person or an architect wanting to come in and do it. What does that job mainly do? Is they're looking at everything at their entry procedures and their facility outlooks to make sure that that school is a safe school. Those are the type of audits that make sure, like a Mount Horror doesn't happen where somebody doesn't get in the front door with a gun. The majority of active shootings take place because somebody leaves doors unlocked and they get easy access to a building. Easily prevented, but it needs to come through a facility audit that takes place. There's a lot of training that we want to do over the next few years related to during the crisis and after the crisis. What we have seen regionally is all of our public schools have a plan of what to do during the crisis, but it's not the same plan. They have different language, different frameworks, different communication. What happens in the event of a crisis, when in a situation like today in Mount Horror, when 911 is called, it is not the police department that just shows up. If we have a situation, when I was superintendent, we had a situation take place at the end of the day. And in that situation, we had the local police, we had the state police, we had the county police, and we had SWAT show up. And if we don't have clear communication, it is the same language and the same message that the first responders, regardless of the department, know. That delays your response. So this is a piece of when we're talking physical safety that leads to emotional safety and how we respond to it. So part of this grant then is we want to be able to collaborate with organizations like I Love You Guys, which is going to help bring in training and resources to our schools so that the vision would be every public school and every non-public school would have the same response to a crisis when it takes place. The same crisis of how we respond in the building and outside of the building in the same language with that. After the crisis is a huge need that we have in our community. A lofty goal that we have that will definitely take more than the 2 years of this award would be that after a crisis happens, a death of a teacher, a death of a student, or a crisis like this, right now they are scrambling to get mental health support lined up and ready to go to come in and support these kids. What our schools don't need to do if they have a death or a tragedy in their school is utilize their own staff to have to provide the mental health support to those kids. But what we don't have in place, and one of our goals to be able to have through this process is to be able to have a regional rapid response team of mental health professionals from within our schools and without our schools, so that should a crisis actually happen, it is one phone call to our office and we're actually able to send out a rapid response team of mental health professionals. Why? Because the counselors, social workers, and psychologists within those schools that are dealing with the crisis, they need to be dealing with it and healing themselves and not being in a place to have to take care of all of their kids and their staff. So that is a piece of this too when we're looking at after a crisis, that we need to have plans in place of a regional approach to be able to support our students and our staff afterwards through mental health. I'm probably very close to the end of my 10 minutes and want to leave time for questions. The one thing that I will share of your timeline, this was a timeline that was submitted when I submitted the grant. This timeline is going to have to be delayed and altered. Looking at it, we're potentially, hopefully going to be approved at the next meeting. A lot of the work that needed to be done in this preparation hasn't started yet because we don't know if we've secured the funding. So we're going to have to adjust our schedule, not our plan, not our vision, but things on this timeline of what we're going to be able to focus on first is going to have to be delayed. What does that mean? We're ready to hit the ground running right now with everything in before the crisis in that The things related to I love you guys and some of that training is gonna have to be delayed because our schools and a lot of our admin, they're off for the majority of the summer, and to be able to schedule those things time-wise isn't gonna happen, so I wanted to be transparent with that up front as well. With that, I would entertain any questions.
Mr. Bloomquist, I have one for you. You mentioned that the Secret Service threat assessment.
Yes, sir.
I have the FBI threat assessment, which I was trained on by Mary Ellen O'Toole. What I didn't hear from you, and it sounds like what I don't want to hear, that this is a one-size-fits-all approach to this. Unfortunately, we have too many one-size-fits-all approaches. What is going to be the approach that you want to take on this?
Related to the threat
Related to,
assessment
let's say, a threat assessment. Give me an example of what you want a threat assessment. Schools has to go lockdown. You go into the Alice, and you're going into your lockdown. What is going to be different? How are you going to handle these situations is not going to be the same. So one size fits all doesn't work. So how are you going to handle that situation?
Well, I'm going to answer that. Hopefully I'm understanding your question appropriately. So I'll say first with the threat assessment training. The threat assessment training that we have utilized is the Salem-Keizer model. It was the first one that was actually developed out of the Salem-Keizer School District in the Pacific Northwest. It's been utilized for over 2 decades. And the U.S. Secret Service and the Department of Education has said that it is a best practice. Are there other models out there? Yes. That's the one that we have been trained on and we use. If other districts don't want to use that model, that's their choice. Why I strongly advocate that every single school district uses that model for threat assessment is because it brings consistency and fidelity in how we actually make those decisions from across the board. Why that is especially beneficial to us at the regional office is the vast majority of those kids that go through a threat assessment, I'm going to say the vast majority, a good percentage of those students end up in our alternative school at Summit Academy. And it brings a great deal of consistency of process, procedure, and follow-up and support when we know people are following the same structured systems. And I don't think that that is anything uncommon of how our first responders handle things, regardless of our military, is having very clear, concise procedures that are understandable across the ranks, brings consistency and fidelity in response. Related to ALICE training, we are never going to tell a school district that they need to do ALICE or they need to do a version of a hide, fight, or flight, or the different trainings that are there. That is a complete local decision that those school districts need to make in collaboration with their school board. What we will advocate for, though, is every single school district that is utilizing some form of an ALICE training or a hide, fight, or flight, whatever it is, that our school districts would come together and collaborate, because what happens is the very first time a school district decides to do an ALICE training, pick any school that you want, any school in Rockford, Lincoln Middle, whatever it is, all of those staff go through that training one time. But next year they have 6 new staff. How do you train those 6 new staff at that school? How do you train 5 new staff at another school? And what we see is initial trainings take place. Ongoing training for new staff regularly does not, because of the fiscal implications of it and the time. But if we were able to have a singular plan that our school districts were going to collaborate and say that this is the type of training that we want to use for that type of response, that brings into place then another critical piece that I said earlier, where we are going to be able to train more effectively, train more efficiently, because then we can host that singular training, call it whatever you want, but then we know that all of our school districts, public and non-public, can send new staff to that training with us, and they know that wherever they go, whatever school that they're in, it is a common training and it is a common language. And that comes down to 2 that between our districts. It can get really confusing in the time of a crisis if you are saying hard lockdown, soft lockdown, or lockdown. All 3 of those responses have the word lockdown in it, and depending on the district that you're in, those all mean different things. So when we're talking about the communication piece, the process is the same. We're either going to keep every kid in the classroom and never let them leave, or they can move around the building and we're not letting any outsiders in. But to be able to have a common language, regardless of building, regardless of district, creates a continuity then of what is going on, and especially when that call goes out. Our first responders that are hearing it, they need to know that if we are saying this district is in a hold, they know what hold means. If they say lockdown, they know what lockdown means. It brings a clear piece of communication for our responders to come.
Does everybody know what ALICE means?
No.
Alert, lockdown, inform, communicate, evacuate. It's an acronym. This, so everybody else knows. But good, all right, Mr. Bloomquist, I think sometimes too, you need co-responders in your building. Okay? You need people who are trained, who can assert themselves in a situation like that. Because obviously, we're all different. We all handle it different. All right, good point, thank you.
Right, and I don't disagree. A huge part of our training, when we talk about who are the first responders to a crisis, it's the adults in the building. In schools, it'll tell me we have an SRO. When we are in those trainings, I will ask the SRO, I believe what school did you teach at?
I'm in East.
You're at East. So you have one SRO, how many SROs?
Usually one, possibly two, depending on the day.
All right, so if that SRO is in the basement where the weight room is, and you have an active shooting in the upper northwest corner of that building, and you have 2,000 students, how long is it gonna take for that SRO to get there? It could be 5 minutes before they actually, an on-site SRO comes, which is why it is mission critical that we have the right things in place before a crisis, and our teachers and staff are trained how to actually handle things during it, because they are the ones right there when it's happening. They are the first responder. So, yes, sir.
Scott, thank you for your presentation.
You're welcome.
I apologize for not remembering from your grant submission, but there's a section on sustainability after
Yes.
the initial funding, and I simply don't recall how you plan to sustain the program after the grant cycle.
Right, with a lot of the work when you're looking at the during and the after the crisis, a great deal of that can be one-time type training, which doesn't go against what I just said a minute ago of ongoing. This first time through, when we're looking at training with threat assessment, or if it's an ALICE training or a trauma-informed care, initially those things we will be able to offer for free, but on the back end of it, when we're talking about sustainability, we already have a fee-for-service model within our school districts. They're used to paying for services. So we believe that after we get through this cycle of that phase, that continual ongoing training that they're gonna need for new staff, that they will be able to share, and they'll pay for that, which helps with the sustainability. Like I said, even in some of our largest high schools, it's not always fiscally responsible, or for a district fiscally reasonable, to bring in a lot of outside training for a very small percentage of people that are new staff each year. But if we can combine all of those regionally and do large scale and share those costs, it makes it more sustainable long term.
Thank you.
And the crisis that you have in school, what percentage is mental health?
That's hard to understand the question, I'm sorry.
The crisis you have in your school, how many of those are related to mental health?
Well, the research will show when you get with an active shooter, almost all of them, trying to use the right word here, 20 to 25% have a diagnosis of mental health. The vast majority of active shooters just haven't been diagnosed. They either haven't been diagnosed because they haven't got the support to go through a formal diagnosis, or when they go through the mental health checklist to look at diagnosis of whatever the diagnosis could be, there might not always be enough check marks to be able to give them an official diagnosis. But the research is pretty outstanding of when you get to that extreme of an active shooter in a school, the vast majority of them have a lot of the criteria of somebody that is suffering from mental health.
Okay.
Did I answer your question?
Yeah.
Okay.
So I guess in that vein, you know, our mission is to provide resources to people with serious mental health, serious mental illness and addiction issues.
Mhm.
I'd like to know more about I see the need for what you're talking about. I'm just trying to figure out if we are the appropriate funding source. How is this going to address those kids that our schools are serving who are clearly in need of intervention because they are demonstrating some behaviors that may mental health problems or mental illness. How does this
Yeah,
relate?
that is a very fair question to ask. One that I had to ask myself in applying that nexus.
Yeah,
So I would say this, I will come back to a major component that I would say the key to all of this is that comprehensive threat assessment training. And that's where I'll speak to the training that we provide. Page 5 of the manual is a non-exhaustive list of things for our schools, that if any of those things are reported to the schools, it automatically gives them the authority to do a comprehensive threat assessment on these students. What we have seen firsthand in being part of hundreds of them being conducted within the former district that I worked in and with our alternative school, with the 20+ years of research behind it out of the Pacific Northwest, and what we have seen in our districts that are implementing, is that threat assessment tool. Every single time when we start asking those questions to the students, the staff, their parents, and other witnesses of what is going on, is where you start identifying all of the FBI determined warning signs and concerning behaviors that were going on in the life of the kid. And when our teachers or when our staff in our schools are implementing that process alone with fidelity and consistency, that is a massive tool that they are going to start what is going on. And a huge component that we train on is then providing comprehensive supports to those students before that crisis ever happens. So that's where I would say that this is a tool, not the only tool, but it is another tool when we're looking at our at-risk students that can oftentimes really fly under the radar. That it opens the door then for multi-tier systems of support, trauma-informed care, restorative practice, outside mental health referrals, inside. I mean, it is a tool that opens the door to all of them.
so this is more, so you would use that comprehensive threat assessment as an identification tool.
The initial purpose of that tool is to determine what the kid said, wrote, posted, printed, or said is a legitimate threat to the safety and security of people today. Where a lot of schools, and we're talking school safety, fall off is we determine they're not a threat today, but what about tomorrow, next week, 6 months from now? And then what are we going to do to support that kid to make sure that they never become a statistic that hurts themselves or hurts others?
And then is there, within this proposal, a mechanism for getting resources to those individuals? Or is that left to the individual?
I would say that it is both and. It's not an either or. Our school districts do have a lot of internal supports that are there. It's not enough when we're looking at the social work and the counseling that is available. A lot of our districts already have partnerships with Rosecrans. Some of our districts are partnering with other outside counseling agencies. But a barrier to getting resources sometimes is we don't even know who needs them. And if our schools don't have mechanisms in place to help identify what students actually need the help, it is hard to actually open the door for them to get it. Which is why through the training that we want to do, it is really a multi-tiered approach that we want to do, bring training into our schools. That is what we would call tier 1, that everybody gets, and it's training that will help all kids. But then as you start identifying kids that need more support, especially in the areas of mental health, it gets down to that tier 2 or tier 3, where you really start honing in on those kids. So this is a mechanism and a tool to help identify that.
Sure, thank you.
Okay, any more questions so that we can move on to the second presentation? Anybody else?
Thank you.
Thank you for your time.
Thank you. The second presentation that we have today is from the Community Foundation of Northern Illinois.
Good afternoon, everyone. My name is Dan Ross. I'm here on behalf of the Community Foundation, but more importantly, I'm here on behalf of the Behavioral Health Advisory Committee that was convened by Chairman Chiarelli and Mayor McNamara. My day job, as was mentioned, I'm the president of the Community Foundation of Northern Illinois. I'm also privileged to serve as the chairman of UW Health Northern Illinois. On behalf of the committee and its 12 member organizations, I want to thank you for this opportunity to present to you about our proposal. As a funder myself, I recognize the extraordinarily difficult task you have in front of you on a regular basis. And I am grateful for the work that you're doing to help better our community and help provide greater services for those in need. I also want to take just a moment to thank some of the members of our committee that have joined us here today, including we've got Jennifer Lauren from Rockford Public Schools, Carol Schuster from the Rockford Regional Health Council and the U of I College of Medicine, and Carmen Cardosi from Rosecrans. Dr. Martell, who is the co-facilitator with me of this group, sends her apologies. She is out of town on business, but would definitely rather be here. Check.
It goes down to the.
Down,
Yes.
thank you.
You're welcome.
Okay, so just real briefly, I know we're on a tight time frame, so what we're gonna go over real quick is a project overview. And I want to devote as much time as possible to answer your specific questions that you provided in advance, but then also to have a dialogue with any other questions that you have. Our proposal is relatively simple, so I'm not gonna spend a lot of time diving into it, but I do want to hit some of the high points for your consideration. So what are we trying to accomplish? I hate it when people read slides to me, but I'm going to do it just in this one situation. So through the use of an expert consultant, our goal is to identify one or more existing models that may be employed in Winnebago County to address the fundamental issues of access and coordination. So what does that mean? We believe that there are solutions that exist in other communities that will fit our needs here in Winnebago County. The question that I'm sure some of you are grappling with is, well, why do you need a consultant to do that? So this task force was convened with leaders from a variety of providers and resources within the behavioral health community. We spent the first several months attempting to identify and vet solutions on our own. It became relatively apparent quickly that there were challenges associated with that, some of which, not the least of which, is we all have day jobs. So we're all doing things on a daily basis that limits the amount of time we can spend vetting these resources across the country. Also became readily apparent that we are bringing with, because of our day jobs, our own opinions, our own, which is the advantage of university, but it also helps to cloud a little bit getting through some of the ideas. But the thing that I think was most apparent to us, and I think it's what's embedded in the specific questions that you asked and that we're going to cover in a moment, is the fact that a lot of folks around the table are by definition competitors. Makes the sharing of proprietary data difficult and sometimes makes it hard to get through to the ultimate solution. So as we spent time evaluating, it really became clear to us that we needed an expert in the industry to help us navigate this. Want to spend just a brief moment talking about our definitions of access and coordination. So access seems like it's probably the simplest thing. When we talk about access, we're talking about a patient or their caregiver getting the basic issues of who, what, how, and when answered. So the who's going to help me navigate this maze? As a member of the UW Health Northern Illinois Board of Directors, I can tell you the number of texts and calls I've got at 1 or 2 in the morning from a frantic parent saying, I don't know what to do. I don't know what to do with my child who's thinking about killing themselves. I don't know what to do with my husband, and it is a real issue for those that are in crisis. The what, I think the what is as big as the who. What services are available, or even more importantly, what services do I actually need? You know, someone who is in crisis or a caregiver who is caring for someone who's in crisis, you don't even know where to start. And so access, that is a big part of the access puzzle. How? It's okay, maybe you figured out what you need, but how do you get access to it? And then the one that we all think about in terms of access is when. And that's the complaint that I think most people hear more often than not is, okay, we've identified the need, I have a need today, I can't get help for 3 months. That is a critical issue that needs to be addressed. When we talk about coordination, hopefully this chart looks familiar to all of you because I took it directly out of their strategic plan 2.0. That was not a gratuitous attempt to point favor with this group, but it is a reality of what I think we are talking about here. We as a committee believe in the community support system framework. We also believe that Winnebago County, and many of them are represented here in this room, are chock full of a lot of amazing organizations and people doing the best they can to care for those in our community. We do believe, however, that as a community, we must identify and implement a coordinating group to bring it all together. A group that is responsible for seeing the big picture, and ensuring that all are working towards the common goal of care. So with that, because as I said, the proposal in and of itself is not particularly complex, I want to spend time on your questions. So question number one, and you probably had a chance to read my response already, but is there a documented commitment from all relevant behavioral health advisory committee members to share the proprietary data with a third-party consultant? The answer is yes. So this was confirmed when we first decided to bring in a consultant, and then since I had the good fortune of seeing these questions in advance before our last committee meeting, I asked the question again. We did talk about and decided not to. When we first submitted the application, we had talked about putting a statement from all of the members affirming our commitment to the process. But since it wasn't something you were asking for, we decided not to provide it. That being said, if this group would like to see it, I am confident we can deliver it in very short order. If you want something in writing, that all groups are committed to sharing their proprietary data. The second question, keeping that same data vein, what kind of data will be shared with consultants, and are the examples you can share? The very short answer is we expect the consultant to drive that process. Now, I'm not trying to skirt the question, but our hope is to identify the right consultant that is going to ask us for what we need. That being said, there are a couple of caveats to that. First of which is we are going to focus on data that is not already publicly available. So that's the data that everyone has access to. We don't need help going through that. That's stuff that everyone has had a chance to take a look at. The intent is also not to repeat the existing data study. So this organization, this group around this table has done a tremendous job of wrapping their arms around the needs of the community. It is not the intent to bring in a consultant to repeat that process. Now, that doesn't mean that that data won't be made available to the consultant, but the intent is not to have them repeat any of the work that's already been done. So examples of potential data points, without knowing exactly what a consultant would be looking for, but the types of things that are not readily publicly available, and candidly are things that I, as chairman of one of the health systems, wouldn't want to just lay out on the table. Payments, length of stay, diagnoses, wait times, facility survey data, all these things that are critical to us running our business, but really play a bigger part of the greater picture of how we're serving the community. Having a mechanism by which to share that data safely and confidentially and have someone that analyze it, looking at not just our world, but the world of all the participants makes a huge difference. And this really exemplifies why we believe a third party is necessary here. It's not that, excuse me, all the organizations don't have the best of intentions, but the reality it is difficult to share some of this data in a public type of setting. So I know I went fast, but I really wanted to leave time for this. So what questions do you have? Yeah.
I guess I am concerned about the data.
Yeah.
Because working in the mental health field for 41 years, as I did, I mean, I have been through so many consultants, and the collection of the data from the health systems was probably the biggest obstacle to ever completing any of the studies that were done. And a lot of it has to do with you being local and here present, but you're part of a bigger system of care.
Sure.
And the line of command as to who can release the data. And that is something that I know for me, I would definitely want to have that in writing, because I think the most important part of this collaboration, this consultant coming in would be the gathering of this information out of the ERs. You know, we have never over time been able to know exactly how many suicidal patients showed up, how many evaluations. I mean, we get just patches of data.
Well, I can reassure you, as chairman of the board, of one of the three systems, and the system you're referring to that is headquartered elsewhere, the data will be there. But we will put that in writing.
In OSF, I know that a lot of the decisions are made.
Represented at this table are the leaders of all three of those organizations, and they have all made the commitment. I think while there are management aspects that are outside of the Rockford region, we control our own businesses here. And so that data will be made available. It's, you know, and I'll speak just for Swedes because I happen to be the most familiar with it. We see more than one suicidal ideation a day through our ED. So every patient that we have coming in is assessed for it, but the level of diagnosed and not diagnosed behavioral health coming through our ED is astronomical. That data is extraordinarily salient to these conversations, as you said, but it is, as you've experienced, difficult to share under certain circumstances. And so we believe that the use of an outside consultant will allow all three organizations, plus Crusader, plus Rosecrans, plus all of the major players, to be able to safely share their data in a way that it can be synthesized as a community instead of focusing strictly just on one organization. But I can tell you beyond a shadow of a doubt that all three organizations are committed to sharing their data. And like I said, we really did think about it, and Jason was involved in some of those discussions as well about whether or not it would be appropriate for us to pen a letter with all of us signing it saying we're committed. We didn't feel like you were looking for that type of letters of support type of thing, and so we didn't do it.
Okay, I would appreciate it.
Sure, we will deliver that, absolutely. Yeah.
Yeah, thanks for being here.
Sure.
Thanks for your presentation. So I think one of the concerns of this group, and I've been involved in some smaller group conversations about it moving forward, is we're not 100% certain that the committee has a full understanding of what this group has done, a deep understanding. Is it your understanding and the committee's understanding that a consultant, should they come in, would take a deep dive with this group to understand services that are provided, the degree to which they are currently coordinated and or not coordinated? Because I believe that's critical. I'm not here to say that we have been effective at coordinating everything. I think we'd all admit that there are significant levels of coordination that need to occur in this community. So I would be hopeful that the consultant would be intimately involved in discussions with this group and our staff to understand what's been done by this group.
Absolutely, and I appreciate you asking that, and I don't think it came out clearly in my previous slide. So, when I said the intent would not to be to duplicate the efforts of this group, that is absolutely true. The intent would not be to ignore this group. I think the reality is you've done the vast majority of the research already. It's these other pieces of data that you didn't have access to that help complete the picture. So that would be an expectation of ours as a group, that they would be, to the extent without putting a drag on this organization, involve you because you have the data, you have the understanding.
Thank you.
Great question. Yeah.
Okay, Wendy Bennett. There was overwhelming voter support for publicly funded resources for individuals in our community.
Yeah.
And I have a deep concern for the creation of a sort of parallel group that has no obligation to provide their data to this publicly funded organization.
Sure.
Yet you're asking us to provide public money so you can do what you want to do. I
Sure.
understand there's a need, but I want you to explain to me why my fellow citizens' tax dollars should be used to support organizations who are supposed to be providing resources to citizens, and as best as I can see, really aren't, except maybe UW on some level, but, and that aren't necessarily willing to be forthcoming about basic information about who's coming to ask for help, what's necessary. I see a barrier to providing candid, truthful information that will help us all work together. And I have to tell you, I'm a little bit suspicious.
So there's a lot to unpack. There's
Yeah.
probably a dozen questions in
Yeah.
just in there. So I'm gonna start at the beginning, and I hope I don't. But the first question I would ask is, what does this group here view as its role as a coordinating entity? Meaning, are you a service provider, or are you a funder? Are you an organization that is in charge of what's happening with the implementation of these dollars? And that is a question, not a statement, because that's some of the confusion we probably experienced within our group is, we look at it, and I'll speak for me, I'm not gonna say me. So I look at it and say, is this group here the coordinating entity? In conversations with many of you on a one-on-one basis, I don't believe that's your intent. I don't believe
I
that's how.
disagree with that.
Yeah.
Okay, well,
Yeah.
and that's an important part.
Yeah,
Yeah.
I think that's an important part of the discussion that needs to
If
be.
you really understand the community support program that we put in place, it calls for, it's an array of integrated services across the
Absolutely.
community, which means, because we're young, so, but we expect, as we go on, for all of these agencies to be working with one another and have memorandums of understanding that they're going to work with one another. So it's kind of like, yeah, that is our intent. And that's the only way that the program, that's the only way that this community support program works. It has to have integration and commitment to unity among the people that we're giving the money to.
And maybe I asked my question the wrong way. So is this group's intent, and I'm probably faltering completely on the language, is this group's intent to direct the activities of that integration?
Yeah.
Okay.
I mean, yeah, I mean, that's what Jason has meetings with our providers in order to promote that sort of relationship between agencies.
Then I think this probably adds even more credence to the fact that there needs to be a better understanding of how all the pieces fit together.
If I could just.
Yeah.
I'd like to, first I'll speak personally, getting away from the term coordinating group. I think as a group, and again, I am speaking personally, we need to be careful not to be open to perhaps a unfettered outside look at what we're doing in this community to see if we're missing something. So I see this effort as more of that than attempting to define the semantics of the community support system. That may or may not be the outcome of whatever someone would say when they would come in, but I'm trying to not be defensive about it and simply say, are we here in this room assuming we're doing everything according to best practice? We're coordinating everything the way we should? I can't be 100% certain of that personally.
And I don't disagree with that. I'm just, as Dick said, I think our organization, we've been in existence for almost 4 years. I think the referendum passed 4 years ago. And what I see is that we are ankle deep in an ocean of need. And while I certainly welcome input, and we have been asking for input from the community to try and better understand and continuously better to understand what the needs and the gaps are. I don't want to get into a tug of war with other organizations over who's doing what and what I think the vision is, and I'm gonna look to Dick on this, because he's, to me, sort of one of the visionaries here. We want a community that functions together collaboratively, where we openly share information, where a funded organization, I will say Rosecrans says, you know, we're having trouble providing resources to children under the age of 10, but we see that in our meetings, a Crusader is doing some initial work here. What else can we do? What else can we draw into the mix? We keep wanting the circles to get broader and broader. And what I would hope is that our medical resources in this community would open to this process and support it and participate in it more completely.
So
because that's a gap. That's definitely a gap.
What does that look like? And that really is a question. And I
think
sense
we're
an
in a
adversarial
process.
conversation.
No, I
That is
don't
not
want to
my
be
intent. I am not saying that it's
Right.
our organization versus
Right.
this organization.
Right.
That's how you framed it when you approached it with me. So I want to turn that back
Right.
and say, that is not the intent of this.
Okay,
But
good.
what does what you just said look like? So what does it mean for a health system to engage with this group?
Well, I guess one of the things I was hoping for over the last 4 years is funding proposals from our hospital systems that ask to support specific absences in our community. For example, child psychiatry is a huge gap in service in our community. And what conversations I've had with people who are available to provide those resources are saying, we're having trouble recruiting, we're having trouble funding, we're having trouble supporting those kinds of resources. And through U of I think we're starting to look at how can we broaden those things. But we haven't heard much from the healthcare systems, you know, and we'd love to. We
What
really
I
would.
can't speak to is, A, what any of the other health systems have done over the past couple of years, nor really can I speak to what's happened. You know, I think the group that I'm a part of was convened to take another look, not to take a competing look, and there's a big distinction, but to take another look and say, how do these, you know, whether or not, and I'll ask the question back to this group, have you convened the health systems to have a discussion? And that's a question, not a statement. Yeah, and so this group was intended to bring together the leaders of all these, as you succinctly mentioned, disparate groups, to say, okay, what can we do better? And so this is the output thus far, saying, okay, we need to understand with our data what else we can do.
Bill, that's your question?
Pardon me?
That's your question?
Exactly.
Yeah.
So my question is, get over the semantics, understand what we could do as a community together better.
And I think we all applaud that effort. And it's, to me, I think that right now, what we're trying to do too is to pass this referendum again and not confuse the public as to what is going on. You have the mental health board, and we're, you know, the inaugural board. It is, you know, we're an infant. We are growing. We want input. But I think also the idea of a consultant, we've all dealt with consultants, and they haven't always turned out to be.
Absolutely.
I mean, it's been a waste of money. Many times, I hate to say it, but it's a fact of life. So I feel, you know, your committee and our board really have not, this is probably the most communication that we've had.
And I don't mean to put anyone on the spot, but I think that's part of why we thought Jason was a part of
Well,
the committee,
he is, but
to sort of represent the mental health board in the discussions. I think Jason's done a wonderful job of that and has shared Bob's concerns as well. So, you know, I guess as a co-facilitator of the committee, I'm not sure what else interaction, as a public entity, there's finite amount of interaction we can have with you outside of
that's
this.
true, because it's a public.
So again, I will ask the question, what does it look like then? What is it that you envision for us to interact with this group outside of a grant application and a discussion in a setting like this? And that is a question, not a comment. So I think it is easy to sit back and say, the folks on this committee aren't doing your work, meaning the Behavioral Health Advisory Committee, we're not doing our work, we're just coming in and saying, we need money. But we need to understand if there's specific things that this board is looking for, tell us. We can't divine that. And so if there are things that you're not getting from the systems, or you're not getting from the other participants in this committee, you gotta tell us. And tell us how to interact with this. Because as a former, you know, public committee board member, it's limited. I can't call you up and say, hey, why don't the six of us go out and have a drink and talk about this? We can't do that. And so we need to know if there are things that you're looking for that you're not getting, how do we provide that?
Well, I guess this is my final question. Can you just tell me, if you're instructing the consultant, what do you want the consultant to actually do when they start?
So it was in the application.
I saw
In the
that, but
application.
just from your.
So we are looking for them to go out and look for best practices across the nation. So we looked at just examples. So we talked to some of our colleagues downstate. We talked to some of our colleagues in Chicago. We talked to some of our colleagues in Wisconsin to see what are the different lines that they've employed to provide a more integrated approach to behavioral health in the community. That's what we're asking for the consultant to come back and say, take a look at our data and our situation, see what's out there in the rest of the country. We don't need to reinvent the wheel here. We're unique, but we're not that. What's out there that we can bring back and make our own? and put something into place that's gonna have material change.
And then for sustainability, how would you put that into practice?
So going back to
Through your
your
house
comment
system?
earlier, and absolutely, there's not a one-size-fits-all solution. So there's gonna be multiple partners, as you can imagine that, and funding is gonna be a big piece of it. And I can share my vision for it, but I don't think it's appropriate in this format, but there are a myriad of ways, including financial commitments from the partners involved, potential future dollars from the mental health board, potential state and federal dollars. There is a litany of dollars that are available. It's how are we going to best use those?
If I may, first of all, thank you. This has been extremely helpful to me to understand, and I appreciate the questions that have been asked because they voice some of my concerns. But I'm sort of along the lines of what Bill is getting at. If I understand correctly, there's certain, yes, we've done a whole lot of work, but there's certain things, particularly in the area of confidentiality, where a consultant could get past some of the natural barriers that computers have to give us a fuller picture. And I get that, and I'm for that. I guess my question gets at, and you were starting to answer this just now, so I just wanted to push a little bit.
Yeah.
I guess my concern is not what our vision is for the whole coordination piece, but what is your group's vision? Because we are publicly sanctioned, publicly funded, give public reports and all that kind of stuff as a result of the community saying we wanted this. Health systems saw perhaps a need or whatever. So what is your vision as it relates to what you all's role is in that whole coordination?
The very short answer is we don't know. I think that's the point. That is probably the best case for why we're doing this, is we don't know what the best solution is. We don't even begin to think this committee of leaders from various organizations are going to be the coordinating entity. That's not what we're saying. It may turn out that they might say it's this group that is going to handle not just the funding, but the administration of bringing it. We don't know. But we know our communities are doing it well. And so we want that expert eye to take a look and say, what can you do differently? But in no way, shape, or form are we saying it's us. I mean, it would be impractical for it to be us. You look at the folks around the table, and that it doesn't make sense. And so we don't have, and I think that was an important part for us to get into these discussions, was for all of us as independent organizations to set aside our beliefs. To say, you know what, I would guarantee our friends at Rosecrans have thoughts, I guarantee our friends at the school district have thoughts, but we don't know if any of those are the right way to go. And so we believe to take, as you talked about, the data that we can't just share. We can't just share data with the community on who's coming into the PD. We can't do it. We can, in the right setting, share that with the consultant. We need that data to inform the decision that you're talking about, to say, how can we find the solution that makes sense for Winnebago County today, but then more importantly, it's going to be sustainable beyond today.
Okay.
Thank you.
Okay, thank you so much. To the action item for the monthly report, should we, I have that.
Yeah, let's bypass that since we have.
Okay. We'll move on to the action items. We'll need the minute meetings from the April 2024 meeting approved.
So
I have a motion.
Second.
Okay. Who?
Of course,
Okay, very good.
Second.
Okay, we can just do a hand vote in this. All those in favor, please say aye. Okay, the meetings have been approved. Moving into the program year 23-24 special conditions met. Jason, do you want to just brief us on that?
We just had one this month, and actually I would defer to Nicole if she wants to make any comment on it. Otherwise, I think the details are in the document itself.
Yeah, no questions. No, unless anybody has questions on the documents that are in there.
can I only just say that thank you, they're extremely thorough. So thank you to all of you for putting things together like this, because it really clarifies, and it's just well put together.
Well,
Okay, and we need a vote, a motion on that to approve. Here, Mohammed, okay? And this one does not, involve money, we can do, payroll, so all in favor?
Aye.
Opposed, same sign. Thank you. All right, moving on to the resolution 24X, authorizing funded program budgets update for program year 23-24.
So because there are 8 of these, I'm not gonna go through each one. I tried to also be thorough in putting this together with enough detail. We have a representative from each one of these organizations who are available if you have specific questions. But otherwise, we try to appropriately gather the information so we had enough detail to understand what was being requested for each one. Just the last thing I'll say is, May is the last month of this particular program year, so that's why you're seeing so many of these. People were kind of looking at maybe where they had underspent on their budget, where there was not time to make that up, and what could appropriately within the scope of their work maybe need some support. So this was encouraged by us because we don't want to continue to build surplus. We want to get the funds out for the things that they're supposed to be advancing.
We will need a motion to move this forward and then,
So moved.
Second.
okay, any discussion on, we're taking them all at one time.
Yeah, there's 8 as part of this resolution.
Okay. So anyone have any discussion or concern or question? Okay, hearing none, we will do the roll call for this particular 8 resolutions. Dr. Copeland.
Aye.
Dr. Jardine.
Aye.
Dr. Gorski.
Aye.
Dick Bruner.
Yes.
Wendy Larson Bennett.
Yes.
Tim Mater's absent. Mohammed Yunus.
Yeah.
And Mariana Abadi, yes. Okay. Quite a bit.
Well, no, that's quick.
Down to this. Okay, this is resolution 2024-XX. This resolution authorizes Winnebago County Community Mental Health Board funding and allocation of special project funds for accelerated award applications. Whereas the Winnebago County Community Mental Health Board published a 3-year strategic plan defining priorities and target population for the program's year 4 to 6. Whereas the Winnebago County Community Mental Health Board published a notice of funding seeking proposals designed to be funds that accelerate time-sensitive work and launch launch capital projects regarding improving mental health and substance abuse services, specifically in Winnebago County. Proposals to impact human capital, the skills, knowledge, and experience possessed by an individual or population, viewed in terms of their value or cost to an organization or community. The social capital, the network of relationships among people who live and work in a particular community, enabling that community to function effectively, and physical capital, the tangible, human-made goods or assets such as buildings, materials, and supplies. Whereas the Winnebago County Community Mental Health Board received 7 applications requesting funding totaling $6,023,911.63. Up to $10 million is available for funding accelerator awards. Whereas the Winnebago County Community Mental Health Board members reviewed, evaluated, scored the 7 applications according to established scoring rubrics that were published alongside the notice of funding and developed recommendations for these organizations and programs. Now therefore be it resolved by the Winnebago County Mental Health Board, the fund shall fund the following proposals. Crusader Community Health, the Crusader Community Health Dedicated Behavioral Health Clinic Space for $450,000. Marshmallows Hope nonprofit organization, Marshmallows Hope Intensive Outpatient Mental Health Treatment for $950. Summit Academy, the SOAR Academy SEL Playground for $303,278.63. The University of Illinois College of Medicine Social Work Opportunity Track SWOT, SWOT, $2 million. Is that right? Yeah. The YMCA of Rockwood Valley, the Neighborhood Youth Enrichment Center, $320,483. The Winnebago County Community Health Board shall not fund following proposals after review of the application. Alignment Rockford Healing Center, student support, strong families, strong community. Request does not align with our strategic plan. NAMI Northern Illinois Resource Center. Capacity scale of the organization does not align with funding proposal. Okay, so I will need a motion for this resolution to be approved.
Also move.
Okay, Wendy?
Second.
Okay. Any questions, discussion? Okay, hearing none. Let's write this. Okay. Okay, Dr. Copeland.
Aye.
All right. Dr. Giardini.
Aye.
Dr. Gorski.
I will abstain, and by virtue of explanation, I sit on a fund development group for the YMCA, and legal counsel through Jason has advised me that abstention is appropriate.
Okay. Dick Quinner,
Yes.
Wendy Larson Bennett.
Yes.
Tim Neighbors absent. Mohammed Yunus.
Yes.
Mary Ann Abadi, yes. Moving on to the final resolution, is that correct? Okay. This resolution 2024 XXX, resolution authorizing the Winnebago County Community Mental Health Board Accelerator Awards preliminary review determination for applications received. Do you think I can forego the legal jargon?
This is,
Yeah, ditto.
this is the, new applications that have been received and the initial screening threshold level to determine which are appropriate to go to the full board.
Okay, so following is the Winnebago County Community Mental Health Board is willing to evaluate the score of the following. It's City of Rockford Mental Health Awareness Program. Ineligible for review is the AED Essentials, Enhancing First Responder Preparedness, Implementing High Fidelity Stimulation Training, does not fit with strategic plan, not serving or aligned to target population. Second one is RAMP, Hiring Pilot Project for People with Mental Illness via Strategic Partnership, RAMP. This does not fit with strategic plan and no added, no value added in perpetuity. And the last one is Brightpoint Rockford Crisis Nursery Expansion Project. Again, it does not fit with strategic plan, not serving aligned target population. So I'll need a motion for this.
So,
Second.
Okay. Any discussion, questions? Okay, hearing none. Dr. Copeland.
Aye.
Dr. Giardini.
Aye.
Dr. Gorski.
aye.
Dick Koner.
Yes.
Wendy Larson Bennett.
Yes.
Kim Neighbors absent. Mohammed Yunus.
Yeah.
Mary Ann Abadi, yes. Okay. All right. No discussion items that I have on my agenda.
Since we have a few extra minutes, let's go back to the monthly activity report, because I do want to highlight the Building Bridges to Recovery event that's
Yes.
coming up on May 16th. And certainly we encourage board members to attend, members of the public to attend. It's a great opportunity to not only hear from a national speaker who's going to be speaking about his own addiction recovery, But also, there's gonna be booths from the funded organizations that will be there to share information about their programming, what they're doing. Certainly that can be with regards to program entrance, but also for general members of the public who want to know what's going on with the half-cent sales tax, what it's funding, it's an opportunity to directly interact with those program providers.
There are the flyers in
There
there.
are flyers in the back for everyone.
Yeah, thank you. There are no other matters.
Well, I make a motion for adjournment.
We need a second.
Second.
All those in favor, please say aye.
Aye.
Any